Hi, I'm Molly. I'm a graduate nursing student here at Auburn University. Today I'm going to be performing my head-to-toe assessment on Steven. Steven, is it okay if I do this head-to-toe assessment on you?
Yes, it is.
Okay, great. So we're going to start by going over your vital signs. So the nurse took your height and weight and all your vital signs. All your vital signs were within normal limits, and your height and weight put you at a BMI of 24, which it still falls within the normal category, which is good. So I'm going to start by inspecting your head and your scalp, and I don't see any lumps, lesions, pest infestations. Your skin is clear on your face. You have a little scruff there.
Yeah.
So I'm going to look, can you occlude one nostril and sniff for me? All right, do it on the other side. All right, you have a patent airway. I'm going to grab this light. I'm going to look up your nose. Okay. All right, your nasal mucosa is pink and white, terminates. Look good. Your septum is midline. Your lips are pink and white. Can you open and say "ah" for me? All right, your teeth and your gums look good. Your tongue looks good. Move your tongue up for me. Up for like ah. Okay, your floor of your mouth looks good. The roof of your mouth looks good. Everything looks good. So now I'm gonna inspect your eyebrows. They look good. Can you close your eyes for me? Inspect your eyelids. They look good. All right. So now I'm gonna pull this down. Look down. All right. Now look up. All right. So your cornea, your sclera, your conjunctiva, and your iris all looked good. I'm going to do a light reflex on your eyes, so just look straight ahead on for me. Okay. Okay, now I'm going to do the cover test. So I'm going to use this card and I'm just going to put it in front of one eye. Just stare straight ahead. Stare straight ahead. Okay, that's good. Now I'm going to use the ophthalmoscope. My light, my hand on your shoulder. Okay. 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 The red reflex, the macula, the macule, and everything in your eyes looked good. Next, we are going to look at your ears. So I'm going to use the otoscope to look into your ears. I'm going to palpate the auricle. Any pain or tenderness?
Nope.
Okay. All right. Your tympanic membrane is nice and pearly gray. I can see it's kind of white. Pain or tenderness?
Nope.
Okay. Same thing, pearly gray. I can see the cone of white. All right, I'm going to go back and I'm going to palpate your head for any pain or tenderness. Any pain or tenderness anywhere?
Nothing.
All right, your frontal sinuses, any pain or tenderness?
Nothing.
Maxillary sinuses?
Nothing.
Do your TMJ, can you open your mouth open wide for me? Any pain or tenderness?
No.
All right, great. Next, we're going to move on to your cranial nerves. So I'm going to start by assessing cranial nerve 1, the olfactory nerve. So can I get you to close your eyes for me? And I'm going to put a scent under your nose and let me know what it smells like.
Something sweet.
Okay, that was, let me open a new one. What does this smell like?
It smells like alcohol.
Good job. All right, so next we're gonna move on to cranial nerve 2, which they tested your visual acuity whenever they tested your vital signs outside. So you were 20/20 in your left eye, which is good, and you were 20/30 in your right eye, which means in your right eye you can see at 20 feet when a normal eye can see at 30 feet. So we're also gonna test your visual acuity by placing place this hand over this eye. All right, let me know whenever you see my fingers.
That's him. That's him. That's him. That's him.
Okay, keep that one there. Okay.
I see him. I see him. I see him. I see him.
Okay. Now we're gonna switch to the other eye.
I see him. I see him. I see him. I see him.
Okay. Now you keep that hand there.
I see him. I see him. I see him. I see him.
Okay, great. You're gonna do cranial nerves 2 and 3 together, and I'm gonna get this light, and I'm gonna look for your pupillary responses, direct and consensual. So just look straight ahead. Okay, those are good. All right, so I'm gonna turn this off. And I want you to look at this and then look at the wall behind it, back and forth, back and forth. Okay, that's testing for accommodation. Okay, so next we're going to test cranial nerves 3, 4, and 6, which are extraocular movements. So I'm going to get this here. Just want you to follow it with your eyes. Okay, cranial nerves 3, 4, and 6 are all intact. So for cranial nerve 5, there's 3 different tests that we do for that. So first of all, I'm going to get you to clench your teeth, and I'm just going to palpate. Okay, now I'm going to get you to close your eyes and let me know whenever you feel this cotton ball touch your face.
Feel it, feel it, feel it, feel it, feel it, feel it.
All right, I'm going to do the same thing with something a little bit harder, so let me know when you feel it.
Feel it, feel it, feel it, feel it, feel it, feel it.
Okay, great. So cranial nerve 5 is intact. So for cranial nerve 7, it's a facial nerve, so we're going to make a bunch of different faces. So can you smile for me? Can you frown? Can you show me all your teeth? Can you puff out your cheeks? Can you wrinkle your brow? Next, we're going to do the whisper test. So I'm going to come behind you. This is for cranial nerve 8. And I'm going to whisper something in one ear and want you to tell us what you hear.
Okay. I love my sister. She's the best.
Great. So next we're going to test cranial nerves 9 and 10. I'm going to get a tongue depressor. We're going to do the uvula and gag reflex. While we're at it, we're also going to do cranial nerve 12. And we're going to get you to move around your tongue. So go ahead and move around your tongue for me. That's cranial nerve 12. All right, so open, say ah. All right, so the cranial nerve is intact. All right, so the last one we're going to do is cranial nerve 11. So can I get you to shrug your shoulders for me? Like, shrug them? Yeah. Okay, cranial nerve 11 is intact. And then also cranial nerves 5, 7, 10, and 12, I was assessing by your articulation and your voice and speaking to me, which you were able to do all of that well.
Perfect.
Perfect. All right, so now I'm going to inspect your neck. Trachea is midline. I'm going to palpate your lymph nodes. So we have your pre-auricular, your post-auricular, your occipital, your parotid, your tonsillar, your submandibular, or submaxillary, submandibular, your anterior cervical chain, your posterior cervical chain, and your supraclavicular. Okay? Can you do some neck range of motion for me? Can you flex, extend, rotate, and lateral bend? All right, so next I'm going to palpate your carotid one at a time. All right, I'm going to listen for some bruits with my stethoscope. All right, I didn't hear any bruits. I'm going to palpate your thyroid gland. Get some water here. Okay, so take a little sip and hold it in your mouth. Okay, look down and to the right and swallow. Okay, we're gonna do the same thing on the left. Down and to the left, swallow. Okay, take that back. All right, so now we're gonna assess for external jugular extension, and then we're gonna do it with you laying down to do internal. So I don't see any signs of internal jugular vein distension. All right, we're gonna lay you back and look for internal at 45-degree angle. All right, and skinny on that side. Not able to see me on that side either. All right, we'll go ahead and sit you up. All right, so now I'm gonna get you to stand up and turn around for me. So I'm gonna lift up your shirt to inspect your posterior thorax. All right, the skin looks clear. I'm gonna assess for breath sounds. Okay, I'm gonna palpate. Let me know if anything hurts or has tenderness.
No.
No? Okay. So I'm gonna do diaphragmatic excursion. I need you to take some deep breaths from me. Okay. Good. Right now I'm going to percuss down your back. Then I'm going to auscultate from the bases to the bases. A deep breath. Now I'm going to go back and percuss for diaphragmatic excursion. So I'm going to get you to take a deep breath in and hold it for me. Okay. Piece of tape. Yeah, you can let it go now. All right. Now you're going to do the opposite. Get your breath and then you're going to let it out and you're going to hold it. Okay. Alright. And that's the diaphragmatic excursion. Okay. Next I'm going to assess for CVA tenderness. So let me know if you have any pain with this.
Nope.
Okay.
Nothing.
Alright. You can have a seat back on the table. Alright, so I'm going to inspect your front thorax. Okay. Got some hair. Besides that, nothing else. Alright, so I'm going to palpate for any pulsations or thrills. Does any of that hurt?
Nope, nothing hurt.
Alright, so now we're going to do the same thing, the tactile test, where you're going to say, I don't think I did this on the back. I'm going to go on your back first, and I'm going to put my hands on your back, and I'm going to get you to say 99 every time you feel my hand on your back. Okay? Okay?
99, 99, 99, 99, 99.
Okay. Now we're going to do that on the front now.
99, 99, 99, 99.
Okay? Good. Now I'm going to percuss on the front. Auscultate. Big deep breath. Alright, now I'm going to listen to your heart sounds. I'm going to listen in 5 different places. Your aortic, your pulmonic, your second pulmonic, your tricuspid, and your mitral. And I'm going to listen first with the belt and then with the diaphragm. And then we're going to lay you down and we're going to listen in those same exact spots.
Second.
Alright, just laying down. Alright, now I'm going to assess for, I don't know. I say now I'm going to assess for your pulses. So we have your radial, okay, your brachial. I already did your carotid, and then femoral. Alright, next we're going to move on to your abdomen. I'm going to roll your shirt up. Okay, I'm going to look at the contour. It's flat. Your umbilicus is midline. Pulsations and peristalsis, I'm not able to visualize any. So I'm going to auscultate in all 4 quadrants. I'm going to listen for bruits, renal, iliac, and femoral. Okay. Next, I'm going to assess for your superficial anal nodes. Okay. And then I need my hammer. I'm going to percuss all 4 quadrants. I'm going to percuss the liver span. There. Alright, and that's about 4.5 centimeters, so that's a normal liver span. I'm going to do your abdominal reflexes, so alright, that looks good. And then now I'm going to finish with palpations. I'm going to do light palpation. We know, do you have any pain or tenderness?
No.
Alright, deep palpation. Alright, now I'm going to try to palpate the liver. So its borders right there. There's spleen. And your kidneys. eyes, most of the time you aren't able to palpate them. So pull your shirt down, and we will get you to sit up. Can you sit up for me?
Yeah.
Okay. Now we're gonna move on to inspecting your arms. So look at your arms. Alright. Have you finger tenderness anywhere?
No.
Okay. I'm gonna get, can you squeeze my hands? Grips are equal. I'm gonna do your capillary refill. Alright, all less than 3 seconds. Right now, I'm gonna test all of your reflexes. Okay, so I'm gonna do your refill. Okay. Now I'm going to put tricep over here. Okay. And here. Right now I'm going to get the tiller. Okay. Okay. Now I'm going to get your Achilles. So I'm going to get you to kneel down on this chair for me. We'll get your Achilles that way. Okay. Good. Alright, now you can stand up. When we get you to sit back down, we're going to go back and test your coordination. So can you go like this for me? Alright. Can you go like this really fast for me? Alright. Now close your eyes. I'm going to give you something in your hand and tell me what you think it is.
That feels like a coin.
Alright. Good job. That's diagnosis. Next, we're going to inspect and palpate your shoulders. You have any pain or tenderness?
Nothing.
Okay. Pain or tenderness?
Nothing.
Alright. Can I get you to abduct, adduct, internally rotate, externally rotate? Alright, hyperextend, or hyperflexion, extension. Alright, now with your elbows, any pain or tenderness? Pain or tenderness? Alright, so flex, extend, pronation and supination with your wrists, flex, extend, ulnar and radial deviation, not with your elbows, just with your wrist. Yep, with your fingers, flex, extend, and abduction. Okay, great. Now you can stand up, and we're going to do your hips. And can you abduct on both sides? And then we did adduction to come back in. Can you flex both sides forward and extend them back? Okay, internally rotate, cross it in front. Same thing on the other side. Externally rotate. Okay, can you flex them both and extend them both down? With your ankles, can you plantar and dorsiflex? Inversion and eversion. Okay, inversion and eversion. Alright, do you have any pain or tenderness with palpation?
No.
Alright, can I get you to slip off your shoes for me?
Yes, you can.
Alright, go ahead and slip off your socks too.
Really should have cut my toenails last night.
Alright, have a seat down there. Alright, so I'm going to palpate your upper trochanter nodes. Feel great? Alright, you're going to do your count refill. Alright, going to check your popliteal pulse. Feels good. Your reticularis posterior tibialis, dorsalis pedis. I'm going to do the Babinski. Alright. You can pause it. Ready? Go. Alright, so I'm going to inspect your legs. Your legs look good. All right, close your eyes. I'm gonna tell me whenever you feel this cotton ball.
No. 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 No.
All right, so now tell me whenever you feel this deep pain.
No. 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 No.
Okay, now do it on your arms. Tell me when you feel it.
No. 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 No.
All right.
No. 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 No.
All right, now it's gonna be vibration, okay?
Okay. No. 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 No.
Okay, great. Next, we're gonna do muscle strength. So can you pull your legs towards the cabinet for me? Great. Here you have enough muscle strength. Lastly, you can hop them down. We're gonna inspect your spine. All right, looks nice and midline. Is there any pain with palpation?
No.
All right, can you bend over for me? This is assessing for scoliosis. All right, you can straighten back up for me. So that was forward flexion. Can you extend backwards for me? Can you rotate side to side? And can you lateral bend for me? Okay, that's great. All right, so I'm gonna get you to walk towards the camera, heel to toe, heel to toe. Like, can you put them next to each other like this?
Oh, heel to toe. I thought you meant like walking heel to toe.
All right, now turn around and walk toward the camera on your tiptoes. And come back. You're gonna walk on your tiptoes again. And then lastly, we're gonna do the Romberg test. So turn around towards the camera, put your arms out straight beside you. All right, now close your eyes. All right, assessing for swing. All right, put them down. All right, guys, thanks for watching. Next, I'm going to test for lateralization, and I'm going to strike the tuning fork and put it above your head, and let me know if you hear it equal on both sides.
Okay. Yes.
Okay, great. Next, I'm going to test for ear and bone conduction. So I'm going to strike it, put it behind your ear, and just tell me when you don't hear it anymore. I'm going to put it in front of your ear, and you should hear it a little bit longer.
Okay. Okay, stop tuning it.
Okay.
Okay, stop tuning it.
Okay, we're going to do the other side.
Stop tuning it.
Okay.
Stop tuning it.
Okay.